Hi. I'm robo-Suzie and today I'll talk to you about thrombosed hemorrhoid treatment. Also don't forget to check out the link below, for the most comprehensive, multifaceted program for fixing hemorrhoids. It has a very high success rate. But back to our topic. Hemorrhoids are annoying and painful. They can also be dangerous if left untreated and diagnosed correctly. Thankfully, if you do have one, there are a lot of options for treatment that includes natural, non-surgical, and surgical methods. Thrombosed hemorrhoid treatments are available through most hospitals and family clinics. Some natural remedies can even be done at home. What are hemorrhoids? Hemorrhoids are inflamed, swollen, or enlarged veins in the rectum or anus. High rectal vein pressure and increased straining may cause them. Extended periods with diarrhea or constipation with hard stool may also contribute. Thrombosed hemorrhoids are hemorrhoids that have been blocked by blood clots. These commonly show as hard lumps and are painfully swollen. The symptoms of hemorrhoids. Symptoms of this disease include pain and swelling in or around the rectum and anus, especially during defecation. Most people experience hemorrhoid symptoms, but most of these will go away within a few days. If you think you have a hemorrhoid, it is important to visit and consult a doctor for a proper diagnosis, because some other more serious and sometimes life-threatening disease present with similar symptoms as hemorrhoids. Diseases that have similar symptoms are rectal cancer, anal fissures, anal abscesses, anal fistula, and perianal hematoma, among others. During diagnosis you may expect external analysis and, in the case of internal hemorrhoids, an endoscopy. In cases of ruptured or bleeding has occurred, tests are also called in to see if there is an infection. If hemorrhoids are found, they will be classified. Thrombosed hemorrhoid treatment procedures will vary according to the state of your hemorrhoid. The treatment options. There is no one cure for hemorrhoids, but treatment regimens do exist that are exceptionally effective. Hemorrhoids that have just presented, new ones that have only been there for 2 or 3 days, and small ones are usually treated conservatively. This means only a change in diet, sitz baths, analgesics, proper anal hygiene, herbal remedies, and sometimes topical creams. A high-fiber diet and proper intake of liquids is recommended for all hemorrhoid sufferers to prevent hard stools. Proper care should also be taken to prevent liquid stools and diarrhea, as this may also cause pain to the hemorrhoid sufferer. Cold compresses and hot baths can help relax the veins and heal the hemorrhoid. Ointments and suppositories can provide pain relief and lessen the inflammation of external hemorrhoids. These practices can help prevent further development and irritation of your hemorrhoids. Thrombosed hemorrhoid treatment may also mean some medical procedures. Rubber band ligations, the common method of dealing with large hemorrhoids, are done with elastic bands applied to a hemorrhoid that cut off circulation to the hemorrhoid, and it will slough off with normal bowel movement in a couple of days. Enemas are also sometimes done to clean the area, though extreme care must be taken, and the procedure should be done by a doctor. Laser, infrared, or electric cauterization can also be used. Infrared coagulation is the most common non-surgical procedure in the United States. There is no perceivable advantage to each of these procedures, and personal preference is usually the deciding factor on which technique shall be used. Depending on the case, minor surgery to remove the clot or the hemorrhoid itself can be used. Thrombosed hemorrhoid treatment is done through a multitude of options that are available depending on the doctor or hospital. Sclerotherapy uses injections of hardening agent on hemorrhoids that harden the veins and causes the hemorrhoid to shrivel up. Grade 3 or Grade 4 hemorrhoids, usually the largest ones, are usually treated with hemorrhoidectomy, which is a true surgical procedure in which the hemorrhoid is lanced of the area. This is most effective in cases where non-surgical therapy has not worked or with large hemorrhoids with severe symptoms. Post-operative pain is the most common major complication of this procedure. It may require 2 to 4 weeks before the patient can return to normal activities after the surgery. Thrombosed hemorrhoid treatments are numerous and varied, but it still remains a fact that conservative medical therapy and natural methods are best when dealing with early stage and new hemorrhoids. One should keep in mind that one must ask consent from their doctor before taking or applying these remedies to avoid conflicts or other possible drug interactions that may harm the patient. Natural astringents like witch hazel, cranesbill, honey, and aloe vera are used to soothe the affected area and reduce swelling. Ice packs can relieve inflammation and irritation of hemorrhoids. Dietary supplements like bilberry extract, horse chestnut extract, butcher's broom and other bioflavonoids can help treat hemorrhoids by helping strengthening, protecting and relieving vein problems. An effective and well-balanced fiber-enriched diet will not only help with your current hemorrhoid but will also prevent future ones. Other physical techniques have also proved effective in relieving hemorrhoid pain. Using the squat position during bowel movements have been tested, though inconclusively, against hemorrhoid occurrence and had somewhat proved effectiveness. Thrombosed hemorrhoid treatment techniques like raised legs during sleep may help enlarged veins return to normal size. Hot baths can also help relax the veins and help with the pain. Wearing loose clothing and light underwear may help the sufferer, as tight clothes can often add to the irritation and pain. Kegel exercises used to strengthen the pelvic floor muscles can also help with the pain. Thrombosed hemorrhoid treatments may be covered by your insurance company under general medical procedures. As with most illnesses, the natural and preventative measures mentioned here are the cheapest and easiest to maintain. Be sure to check with health professionals about this and other medical advice and implications of your hemorrhoids. Also remember to alert the doctors if you currently have any other medical conditions or if you are taking any medications, especially before surgery. That's it. Thank you. Please subscribe, comment and like this video if it was helpful. See you soon.